Welcome back to Mediklaas. Food impaction. Teeth are part of the masticatory system that help in chewing and reduction of food. This is possible with the proper form and positions of the teeth in the jaws. Alteration of the form and position of teeth can lead to altered masticatory function and also lead to periodontal tissue injury. One such condition is called as food impaction. It refers to the forceful wedging of food into the periodontium by the occlusal forces. It can lead to localized periodontitis associated with abscess formation and can also lead to formation of root caries. When the teeth are in contact, the curvatures adjacent to the contact area form embrasures called as spillways. They can either be occlusal or incisal to the contact area, and they are called as incisal or occlusal embrasures, or they can be buccal and lingual or palatal to the contact area, also called as buccal or labial and palatal embrasures. The functions of embrasures is to act as a spillway for food during mastication. It reduces the forces on the teeth, and it also prevents pushing of food into the contact area. Food impaction, as referred before, is forceful wedging of food into the periodontium by the occlusal forces. It can be of two types, vertical and horizontal. Vertical food impaction is from the occlusal direction and occurs due to the action of the opposing tooth. Horizontal food impaction occurs from the lateral direction and occurs by the action of tongue, lips, and cheek. Vertical food impaction is associated with open contacts between adjacent teeth. There is a difference in the levels of adjacent marginal ridges and the presence of plunger cusp. Horizontal food impaction is associated with destruction of periodontal tissues, can be associated with or without gingival recession, and leading to enlargement of the gingival embrasures. The factors causing food impaction can be classified into different types: Class 1, Class 2, Class 3, Class 4, and Class 5. Class 1 is associated with the occlusal wear. Class 2 is associated with loss of proximal contact. Class 3 is associated with extrusion beyond the occlusal plane. Class 4 is associated with congenital morphological abnormality of the teeth and improperly constructed restorations. Each of these classes are further divided into a number of different subtypes. Coming to the Class 1 type, it is associated with occlusal wear. Class 1 Type A. It is associated with the wedging action of the plunger cusp, which leads to the facet formation. Type B. In presence of the worn out distal cusps of the maxillary distal tooth, there is a distal surface of mandibular teeth that comes in contact with this worn out distal cusp, which leads to loss of mesial proximal contact of the maxillary tooth, leading to food impaction. Type C. This is associated with the distal surface of maxillary teeth coming in contact with the worn out mesial mandibular cusp, leading to the presence of open mesial contacts in the mandibular teeth, leading to food impaction. Class 2 is associated with loss of proximal contact between the teeth. Class 2 has 4 types: Type A, Type B, Type C, and Type D. Type A is associated with extraction of the distal tooth that leads to drifting of the tooth present mesially to the extraction site, leading to opening of the mesial contact, which can lead to food impaction. Type B is associated with extraction of a mesial tooth, whereas Type C is associated with non-replacement of any missing teeth. In Type B, extraction of a mesial tooth leads to opening of the distal contact due to loss of the support. In Type C, there is drifting of the mesial and the distal teeth, leading to opening of the proximal contact, leading to food impaction. Type D is associated with drifting after extraction, caries, periodontal disease, and the habits forcing teeth out of position. Class 3 is associated with extrusion of teeth beyond the occlusal plane. In this figure, you can see the presence of occlusal plane and the tooth extruded beyond this occlusal plane. This leads to opening of the proximal contact, causing food impaction. Class 4 is associated with congenital morphology or abnormality of the teeth. It is due to the change in the shape, size, form, and position of the tooth. Type A is associated with tooth intorsion. It indicates that tooth is with a buccal rotation. Premolars are the most commonly involved teeth, where the buccal surface faces mesially and lingual surface faces distally, leading to food impaction. Type B is associated with emphasized embrasure between thick neck teeth. Type C is associated with the facial and lingual tilting of teeth, causing proximal food impaction. Type D is associated with lingual or buccal positioning of the tooth, leading to food impaction in the interproximal space. Class 5 is associated with improperly constructed restorations. Type A is related to loss of contact point in the restoration. An open contact can lead to food impaction between the two teeth. Type B is associated with improper location of the contact point. The contact point is generally situated just below the marginal ridges. Too far cervical placement of the contact point can lead to food impaction. Type C is associated with improper occlusal contour. A presence of flat or worn out architecture of the occlusal scheme can lead to food impaction. Type D is associated with improperly constructed cantilever restorations. Cantilever restorations can cause imbalance in the forces on the teeth, leading to food impaction. Type E is associated with over-contoured processes margin at the mesial and distal aspects. Over-contoured processes can lead to lateral food impaction. Consequences of food impaction. It can lead to certain signs and symptoms. Symptoms include increased pressure in the region of the discomfort, foul smell, and dull pain. Signs seen are gingival bleeding, periodontal abscess, gingival recession, alveolar bone loss, and root caries. Management of food impaction. The first thing to perform is the periodontal treatment, scaling and root planing, curettage if needed, and use of interdental aids like dental floss and interdental brush. This is followed by occlusal adjustment, where the plunger cusps are rounded. The procedure is called as coronoplasty. There is also correction of marginal ridge anatomy if needed. Restoring the anatomy of the grooves in the fossa can help in food escape. Restoration of contact area. This is achieved either by restorations or orthodontic tooth movement. This leads to firm contacts that prevents food impaction. And finally, permanent restoration in the form of crowns or fillings can fill the gap. To summarize, food impaction refers to the forceful wedging of food into the periodontium. Etiology includes open contact, irregular marginal ridge, and plunger cusp. It can lead to gingival inflammation, gingival recession, abscess formation, and root caries. Treatment involves periodontal treatment, occlusal adjustment, restoration of the contact area, and permanent restorations. You can find the link to MCQs for the topic in the description of the video. Thank you for watching the video. We hope you liked it, and if you did, please subscribe to the channel for more videos and hit the notification bell for update on new videos. So see you in the next video. Till then, stay healthy and have an amazing week.